You didn't think it would happen, but it finally did. A cash pay patient didn't stay on your schedule. They self-discharged, they didn't want to be around, or they just ghosted you and didn't stay on your schedule, didn't even show up. What do you do next? And that's what I'm here to share inside this video. My name is Garcia. I help cash-based physical therapists improve clinical outcomes, improve client satisfaction, and ultimately thrive in business. When we look at cash pay patients, if you're a cash-based physical therapist and you've been in business for a few years, or you just started out, you're bound to have it happen. You're going to have a patient not show. You're going to have a patient who doesn't return for whatever reason, and they didn't finish their plan of care. And maybe it was just after the first initial evaluation, or maybe they didn't even show for the initial evaluation. And I'm going to share with you steps to figure out why a patient self-discharges due to poor expectations or satisfaction, and then what to do about it in the future so that it doesn't happen again, and you can rely on great patients who are going to be consistent and you help your business thrive. So the first part you have to understand is you have to figure out why the patient left. And this is the hardest part for a lot of physical therapists. It's hard for us to suck up that pride and say, ask them why they left. You have to figure out why they left. And you can easily say it was non-compliance, it was motivation, they didn't have the financial means to be able to see. There's a lot of reasons why you'll make up, but you need to hear it from the patient's perspective. And so that could be a survey, it could be a phone call, it could be a text, it could be an email. Ultimately, you're trying to understand the reason why people don't see value in what you do. And ultimately, if you're great at your craft and you enjoy working with people, people will feel that, and people naturally want to be helped by those type of individuals. And for some reason on that day or during that course of care, that person didn't feel that anymore. And now you're exchanging value for your service. So now they don't see value in what you did. It's now your job to figure that out. Now, here's the stubborn cash-based physical therapist. It doesn't matter. It's just one patient. No, but that one patient over time ruins your schedule, and you have to ultimately figure out it's probably you. Now, there are some one-off cases, and I completely understand that. But when we're looking at routines and trends, that's what we're talking about here. When you start to see higher volume challenging you and your clinical approach, and maybe your skills aren't that good, or maybe it's your process, or maybe it's just the way you run your own business, but ultimately figuring out that the customer has to understand what you do and what you do for them. And if they're not satisfied, they're going to leave. And so you have to figure that out. And it could be as simple as, hi, Johnny, it's Joe from the local cash-based physical therapy. I noticed that you didn't come in for your appointment, and I completely respect that. I hope you're okay, first and foremost. Number two, I wanted to double check on you and see how your body was doing. It's not, hey, why didn't you show up? It's genuinely caring for the human, making sure that patient feels that you actually are looking for an opportunity to help them again. And when you do this properly, this gives you a chance to help gain that buy-in back. They're like, oh, I'm not a number. It actually cares about me. And when you do that, that's the starting point. From there, just work through, hey, have the exercise been okay? What have you tried? What's not working? That's fantastic. Hey, I'd like to keep you in the loop with, virtual care or whatever it is. Is there anything else I can be doing for you? And perfect. At this point, you've shown that you have no other ulterior motive except for just to connect with them. Once you feel comfortable with that, maybe a day or two later, be like, hey, I forgot to ask. I didn't see that you came in that day and you missed your appointment, but my job is to help people like you, and I'm very passionate about that. And I truly just want to understand, is there anything I did that was not to your satisfaction or liking that maybe you didn't come back in? And your opinion is valuable, and I'll be able to help other people with it. So your truth, your honesty is greatly appreciated. And when that patient sees you're genuine about it, of course, they're just going to say, listen, it was I didn't have the financial means right now. I'm very busy with my schedule, whatever it is. You got to get them to understand that your intent is pure. Once you figure that out, and maybe it was, hey, I didn't feel the pain relief right away, or, I have a busy schedule. Your next question is, okay, so we have to figure out, how do we solve these long term? Because if they're trends, you have to figure out what other patients have done this to you that you never even try to learn from. And that's your job, to improve people's health. And, it's not everybody understands what's going on in your brain, and you have to be able to communicate that. So include it into your process. You have to figure out why it's, how to prevent that from happening in the future. And the next question is, what do you need to do to implement for future patients so that that doesn't happen? So maybe it was, they didn't understand the full 3 months that you're going to be working with them, and you didn't outline every single month and how it was different. And you kept saying, well, we'll just reassess on the next session, reassess on the next session. And when you're that kind of type of a physical therapist where you're, let's see how it goes, people expect to understand what the next phase is. So if you were hiring somebody to build you a house, you would know by month 1, what do you expect? By month 2, what do you expect? When's the framing going up? When are the windows going up? When's electrical going up? That's what people are wondering when they're hiring you too. Okay, so this is going to be paying for it at this point. When do I start to run again? When can I go on the racquetball court again? When can I go play in a tournament again? When can I go back to softball? All those type of things. And if you can't outline those for them, of course, they're not going to come back. So they might say, hey, it just didn't work for me. My knee is not any better, or there wasn't any progressions off of it. I feel like we were doing the same things over and over. Those keywords tell you, okay, you were a bad forecaster. So now you have to implement that. So step 1, figure out exactly what happened. Number 2, figure out how to avoid that in the future. And number 3, what to implement immediately inside working with any of your future patients. Those 3 steps are fundamental to figure out why people leave you. And you naturally are asking yourself that question in your head, and you push it to the side saying, oh, it was them, not me. And the minute that you say it is you have to figure out what your problem is. And now that was okay when you worked in an insurance-based mill or a factory-like setting, because it didn't matter. You had volume right behind you, and you could hide behind numbers, and there was lots of patients coming in the door, and poor satisfaction was okay because the price was so low. And now that you're doing high quality, personalized one-on-one care that's specialized, customer satisfaction is key. And if you don't hone in on this, you are going to fail in your business. I think it's wrong of you to look at and say, well, it's always the patient's their fault. It's their fault. That worked in insurance, not in cash. So if you're seeing you're a high churn of patients who are discharging, or you're trying to avoid that, include these 3 simple processes into your clinical framework while you're trying to learn more skills, develop the business, market, and help, with plans of care and all these other things. You have to figure out that it's not always about new patients coming in. It's helping the quality of your current patients not leave with poor outcomes. And when they self-discharge before a plan of care, they're telling you you're not that good. And now you have to figure out what is it that you need to do. Implement these 3 strategies, and you'll be set up for success in your business.